Well, it's different than like most classes because in biology and in physics, we're all learning from the textbook and there are some labs. But in this class, we are mostly hands-on and we learn through visual and seeing the teacher do it than looking at a book and reading all of what needs to be done.
My name is Stephanie Spencer and I teach at Sequoia High School. The courses that I teach are career technical education courses in the Health Career Academy. So I teach sophomore Introduction to Health Professions and senior Medical Clinical 2, which is a continuation of Greg Schmidt's Medical Clinical 1 class for the juniors.
This class, Medical Clinical Year 2, is more focused on hands-on CPR, focusing on how to learn certain aspects that you can use to get like first response kind of training.
Students should be interested in jobs in this area because this is an ever-growing field. There are new technologies, especially in Silicon Valley and in California, where we are very health conscious. And it's important for us to set a model and a precedent for the rest of the school to be health conscious. We are able to pull in a lot of current professionals and create networking opportunities for students.
I think being in a close-knit group like this, you kind of get to all learn it together and kind of all get to develop like skills that will help you in the future. Throughout this class, there's a lot of like interview process kind of questions, and there's a lot of like debates and like learning other people's opinions and learning how to be in a team and work as a group.
So one of the beautiful things about career technical education is that the content that we learn is applicable beyond the classroom. It's specifically for vocations, but especially in this day and age where applicants for jobs are required to have on-the-job training. Getting that on-the-job training in a high school setting where they're going to show up anyway if they want to complete their K through 12 education it's amazing because these students will graduate with hands-on skills, even if it's only vital signs that they're going to learn, that's great. I think Health Career Academy is really wonderful because it applies to everybody, whether they're going to embark on a career in health after high school or not, because everyone will be a patient if they haven't already been one.
For hard skills, we've learned how to do CPR on an adult and also a child. Through that, we had like a week or two intro, and like we have these handbooks where we learn just reading first, and then we also put it into action. We had to record several videos of us doing CPR on both adults and children, so it was very hands-on.
Skills needed to come into the Health Career Academy is really just a passion for learning and an interest in health. Given these unprecedented times, I believe that most of the student population has an ear towards health. There's been a lot of talk about vaccinations, immunizations, and that alone is enough of a hook for us to generate an interest among students. There are certifications that are offered in the CTE pathways here at Sequoia and the Health Careers Academy. We focus mainly on CPR, first aid, AED, concussion testing. In the junior year, they do CERT training, so Community Emergency Response Team. We are working on some cool things in dentistry and nutrition, and we're always open to new ideas.
We're able to be creative in this class specifically because Mrs. Spencer lets us take a non-traditional route to school. In her class specifically, we don't take any tests. We often have a lot of just class discussion, so a lot of listening and speaking to each other rather than like reading a book and writing, because that kind of goes in through one ear and out the other. Mrs. Spencer is awesome. We all love her. She definitely cares for us like her kids, so it's definitely a different relationship than you might have with other teachers, but she definitely keeps it professional, responsible, but we definitely know that she cares about us.
I would tell a student who isn't sure about this class that even if they aren't interested in going into like a health profession, to take the class, because honestly it's useful skills that even if you're not in a health careers path, it's definitely useful material, and you get a close group and an amazing teacher.